Hello everyone, my name is AIZAT Daniel bin AZMAN under the matric card 9027-2014-X5833-001 under the subject of English for Oral Communication OUM 1303 under the semester September 2021. So today I want to tell you about the assignment course is about sales management at the workplace. So it's about COVID-19. As you know, coronavirus disease, or what we call is as a COVID-19, is an infectious disease caused by the SARS-CoV virus. Most people infected with the virus will experience mild to moderate respiratory illness and recover without requiring special treatment. However, some will become seriously ill and require medical attention. Other people and those with underlying medical conditions like cardiovascular disease, diabetes, chronic respiratory disease, or cancer are more likely to develop serious illness. Anyone can get sick with COVID-19 and become seriously ill or die at any age. So, in any age, wherever you are, young, adult, or old, everyone can get this COVID-19. The best way to prevent and slow down transmission is to be well informed about the disease and how the virus spread. Protect yourself and others from infection by staying at least 1 meter apart from others, wearing a properly fitted mask, and washing your hand or using an alcohol-based rub frequently. So in the office also, we also need to practice everything that I said before. Get vaccine when it's your turn and follow local guideline. So in Malaysia, everyone should have at least 2 vaccine. And as few example, they got a Pfizer and some more. The virus can spread from an infected person's mouth or nose in small liquid particles with the cough, sniff, spit, sing, or breathe. This particles range from longer respiratory droplets to smaller aerosols. It is important to practice respiratory etiquette. For example, by coughing into a free elbow, and to stay home and self-isolate until you recover if you feel unwell. So when you are at office or outside, even you at home, keep yourself and others safe. Do it all. Protect yourself and those around you. Get vaccine as soon as you turn and follow local guideline and vaccination. Keep physical distance at least 1 meter from other, even they don't appear to be sick. Avoid crowd and close contact. Wear a properly fitted mask when physical distancing is not possible in poorly ventilated setting. Clear your mouth and clear your hand frequently with alcohol-based hand rub and soap and water. Cover your mouth and nose with a bent elbow or tissue when you cough or sneeze. Dispose of used tissue immediately and clean hand regularly. If you develop symptoms or test positive of COVID-19, self-isolate until you recover. Wear a mask properly, one of the best way to avoid COVID-19, even they're not 100%, but it's one of the way. So to properly wear your mask, make sure you must cover your nose, mouth, and chin. Clean your hand before put your mask on, before and after you take it off, and after you touch it at any time. When you take off your mask, store it a clean plastic bag and every day either wash it if fabric mask or dispose of in a trash bin if it a medical mask. Don't use a mask with valve or frequently and make your environment safer. The risk of getting COVID-19 are higher in crowded and inadequately ventilated space where infected people spend long period of time together in close proximity. Outbreaks have been reported in places where people have gathered, often in crowded indoor setting, and where they talk loudly, shout, breathe heavily, or sing, such a restaurant, choir practice, fitness classes, nightclub, and office and other place of worship. To make your environment as safe as possible, avoid 3C. Space are closest, crowded, or involve closest contact. Meet people outside. When you meet people outside, outdoor gathering are safe than indoor one, particularly if indoor space are small and without outdoor air coming in. If you can't avoid crowded or indoor sitting, take the precaution. Open a window to increase the amount of natural ventilation when indoor. Wear a mask to avoid them. Keep good hygiene. By following good respiratory hygiene, you protect the people around you from viruses that cause cold, flu, and COVID. To ensure good hygiene, you should regularly and thoroughly clean your hand with either an alcohol, best hand rub, or soap and water. This eliminates germs that may be on your hand, including virus. Cover your mouth and nose, your bin elbow, and or a tissue when you cough or sniff. Dispose of the used tissue immediately into a cloth bin and wash your hand. Clean and disinfect surface frequently, especially those which are regularly touched, such as the door handle and phone screen. And the best main question, what to do if you feel unwell, whether you at house, you at your workplace, or outside. If you feel unwell, here what a few things what you need to do. If you have a fever, cough, and difficulty breathe, seek medical attention immediately. Call by the telephone first and follow the direction of your local health authority. Know the full range symptoms of COVID-19. The most common symptoms of COVID-19 are fever, dry, cough, tiredness, and loss of taste or smell. Less common symptoms include aches and pain, headache, sore throat, red or pain of eyes, dehydrate, skin rash, or discoloration finger of toes. So stay home and self-isolate for 10 days from symptom onset plus 3 days after symptom cease. Call your health care provider or hotline for advice. Have someone bring you supplies. If you need to leave your house or have someone near you, wear a proper filter mask to avoid infection others. Keep up to date on the latest information from trusted sources such as WHO and or your our local authority and national health authority. Local and national authority and public health unit are the best place to advise on what people in your area should be doing to protect themselves. So in this case, coronavirus, we can avoid coronavirus or COVID-19 wherever we locate it, whether you be at home or workplace and other. I will end my speech here. So I hope what I explained to you all is useless and can at least guide to avoid this disease. Thank you.